Are you feeling tired, weak, or experiencing a lack of focus? Well, you might be surprised to learn that these symptoms could be signs of a vitamin B12 deficiency. Welcome to our video where we'll explore the fascinating world of vitamin B12 deficiency symptoms. Vitamin B12 plays a crucial role in the production of red blood cells and the proper functioning of our nervous system. When we don't get enough, our bodies start sending distress signals. Our bodies need this vitamin to convert the food we eat into energy, so when we're lacking it, we can feel drained. Although the vitamin is found in many foods, B12 deficiency and deficiency are relatively common. Symptoms of low B12 can vary from physical to psychological. Studies show that up to 20% of people over the age of 60 in the United States and the United Kingdom are deficient in the vitamin. This is often due to limited dietary intake, malabsorption, medical conditions, or the use of B12 depleting medications. Because the ability to absorb B12 from food decreases with age, deficiency is more common in the elderly. However, this does not mean that children and younger adults, including pregnant and breastfeeding women, cannot develop a vitamin B12 deficiency. So watch this video till the end to know 9 vitamin B12 deficiency symptoms and the best foods rich in vitamin B12. 1. Fatigue. If you are low or deficient in B12, you are likely to feel fatigued. Your body's cells need vitamin B12 to function properly. As such, insufficient levels of B12 can reduce normal red blood cell production, which can impair oxygen delivery. Specifically, vitamin B12 deficiency can lead to megaloblastic anemia. This condition results in the formation of large, abnormal, and immature red blood cells and impaired DNA synthesis. 2. Pale or yellow skin. Like a condition called iron deficiency anemia, anemia associated with a vitamin B12 deficiency may make your skin pale due to a lack of healthy, mature red blood cells in the body. A vitamin B12 deficiency can also cause a condition called jaundice, which causes your skin and the whites of your eyes to turn yellow due to high levels of bilirubin. 3. Headaches. Headache is one of the most commonly reported symptoms related to vitamin B12 deficiency in both adults and children. A 2019 study of 140 people, half of whom suffered from migraines, found that blood levels of B12 were significantly lower in participants with migraines. People with the highest levels of B12 were 80% less likely to experience migraines than participants with the lowest levels of B12. Research continues to investigate whether treatment with B12 might improve migraine symptoms in some people. 4. Depressive symptoms. Vitamin B12 deficiency is associated with an increased risk of depression. Low levels of vitamin B12 can lead to higher levels of a sulfur-containing amino acid called homocysteine. This, in turn, may contribute to the development of depression by increasing oxidative stress, DNA damage, and cell death in the body. A 2020 study of 132 children and adolescents, 89 with depression and 43 without, found that participants with depression had lower levels of vitamin B12 and higher levels of homocysteine than those without depression. In addition to symptoms of depression, low or deficient levels of B12 may lead to other mental conditions, including psychosis and mood disorders. 5. Gastrointestinal issues. Vitamin B12 deficiency may also cause diarrhea, nausea, constipation, bloating, gas, and other digestive symptoms. These problems can affect both adults and children. 6. Difficulty concentrating and mental impairment. Because a deficiency in B12 negatively affects the central nervous system, people with low or deficient levels of B12 may feel dizzy and have trouble concentrating and completing tasks. Several studies have linked low B12 levels with a decline in mental function in older adults. Fortunately, studies show that mental impairment associated with low B12 levels can improve with B12 therapy. For example, a 2020 study gave 202 people with mild mental impairment, low or low normal B12 levels, and elevated B12 levels to placebo for 3 months. After treatment, 84% of participants reported significant improvement in symptoms, such as poor concentration, memory decline, and forgetfulness. 7. Pain and inflammation of the mouth and tongue. Glossitis is a medical term that refers to an inflamed, red, and painful tongue. It could be caused by a vitamin B12 deficiency. In people with this deficiency, glossitis can appear along with stomatitis, which is characterized by sores and inflammation in the mouth. Although glossitis and stomatitis are common in people with anemia associated with vitamin B12 deficiency, they can also occur without anemia and can be a sign of an early vitamin B12 deficiency. However, glossitis can have causes other. 8. Paresthesia in hands and feet. Many adults and children with vitamin B12 deficiency report experiencing paresthesia, a burning or tingling sensation in certain areas of the body such as the hands and feet. Unfortunately, the symptoms of vitamin B12 deficiency overlap with symptoms related to diabetic neuropathy, nerve damage caused by high blood sugar that can cause pain and numbness in the extremities. People with diabetes who take metformin are at greater risk of developing a vitamin B12 deficiency because this medicine can decrease the body's absorption of vitamin B12. Therefore, vitamin B12 deficiency can be misdiagnosed as peripheral neuropathy in patients with diabetes. As a result, many experts recommend that people who take metformin regularly be screened for vitamin B12 deficiency. 9. Other signs and symptoms. Muscle cramps and muscle weakness. Vitamin B12 deficiency negatively affects the function of motor and sensory nerves, which can lead to muscle cramps and weakness. Impaired coordination, ataxia, or poor balance and coordination is a neurological symptom that can be caused by a vitamin B12 deficiency. As such, a person with a B12 deficiency may have difficulty walking and balancing. Erectile dysfunction. Men with vitamin B12 deficiency may suffer from erectile dysfunction due to increased levels of homocysteine in the body. Vision disorders. Vitamin B12 deficiency may cause vision disturbances, possibly due to damage to the optic nerve. Well, after knowing the most important symptoms of vitamin B12 deficiency, let's know the best foods rich in vitamin B12. Vitamin B12 is primarily found in animal-derived foods, so it can be a challenge for individuals following a strict vegetarian or vegan diet to obtain adequate amounts. Here are some foods that are rich in vitamin B12. 1. Shellfish, clams, mussels, and oysters are particularly high in vitamin B12. Including them in your diet can provide a significant amount of this nutrient. 2. Organ meats. The liver, especially beef liver, is an excellent source of vitamin B12. However, it's important to consume organ meats in moderation due to their high cholesterol content. 3. Fish. Fatty fish like salmon, trout, and tuna contain reasonable amounts of vitamin B12. Other varieties such as sardines and herring are also good sources. 4. Meat. Red meat, such as beef and lamb, contains vitamin B12. Lean cuts are generally a healthier option. 5. Poultry. Chicken and turkey are sources of vitamin B12. It's advisable to choose skinless cuts and remove visible fat to minimize saturated fat intake. 6. Dairy products. Milk, yogurt, and cheese are fortified with vitamin B12 in many countries. 7. Eggs. The yolk of an egg contains vitamin B12. However, keep in mind that whites do not contain significant amounts of this vitamin. 8. Fortified foods. Some plant-based foods, such as breakfast cereals, plant-based milk alternatives, soy, almond, or rice milk, and nutritional yeast, are fortified with vitamin B12. Check the product labels to ensure they contain adequate amounts. For individuals following a vegetarian or vegan diet, it's crucial to consider supplementing with vitamin B12 or consuming fortified foods regularly, as plant-based sources may not provide sufficient amounts. Consult with a healthcare professional or registered dietitian for personalized advice. Vitamin B12 deficiency can cause a variety of symptoms, including fatigue, headache, depression, pale or yellowish skin, mental impairment, and pain and inflammation in the mouth and tongue. If you are experiencing these symptoms, it is important to see a healthcare professional to undergo appropriate testing and receive appropriate treatment. If you enjoyed this video, please consider subscribing to our channel to keep up with our latest content. Don't forget to hit the like button and share this video with your friends and family. We'd love to hear your thoughts and feedback in the comments section below, so don't be shy and reach out. Thanks for watching, and we'll see you next time.